My name is Dr. Levitt, one of the vascular surgeons and vascular specialists of Central Florida. Today I wanted to talk to you about carotid artery disease and a new method for treatment of this disease. Carotid artery disease is the leading cause of surgically correctable forms of stroke. Carotid artery disease is basically a buildup of plaque in the carotid artery, usually at its bifurcation, which is located in the mid portion of your neck. The plaque that builds up in the carotid artery consists of calcium, cholesterol, and sometimes fibrous tissue. This plaque can be quite friable, and if it breaks off, it can cause a stroke. A stroke is caused when portions of this plaque break off and block off the blood flow to the brain. If the blood flow is restored pretty quickly and symptoms resolve, this is called a transient ischemic attack, or TIA. If the blood flow blocked off is permanent, this causes an infarction of the brain or portion of the brain to die, and this is a cerebral vascular accident or stroke where your symptoms will be permanent. Vascular surgeons and your other physicians would like to try to prevent this, of course, from happening to you, and so a lot of times we do screening procedures for people that are high risk for carotid artery disease. People that are considered high risk for carotid artery disease are smokers or patients with a history of smoking, high blood pressure, high cholesterol, having diabetes, or having other processes that are known to have atherosclerosis, such as peripheral arterial disease or coronary artery disease. Or if they're having symptoms, then there's lifestyle modifications and also, of course, interventions entertained. If someone's blockage is greater than 80% without symptoms, then this is also someone that we will talk to about doing interventions. But in other people, and basically everybody, we talk about lifestyle modifications. This would include taking aspirin a day, lowering patients' blood sugars, discussing smoking cessation, and being on anti-cholesterol medication, the most common one being a statin medication. Now, if patients have symptoms and their blockage is greater than 80%, or they're asymptomatic, meaning no symptoms, and their blockage is greater than 80%, then this is somebody that we entertain doing an intervention on. Now, the problem with interventions on the carotid artery is that we're doing these interventions usually to try to prevent a stroke, but these interventions can also cause a stroke. So we're very highly selected on who we will do interventions on, and that's why there's a long process in trying to discuss this. Classically, the gold standard for interventions on the carotid artery was a carotid endarterectomy. This is a great procedure, and this is the gold standard which all other procedures are actually measured against. Some patients were felt to be very high risk for a carotid endarterectomy, and lately, in the last 10 years or so, people have been performing carotid stenting. Carotid stenting through the transfemoral route or through your groin has had good results in high-risk patients, but has shown to have a higher stroke rate than a carotid endarterectomy. Lately, we're very excited that there is now a hybrid procedure that can be done that sort of combines the benefits of both procedures. This procedure is called a TCAR procedure, or Transcarotid Artery Revascularization. Transcarotid artery revascularization is done through a very small incision just above your clavicle, and then a puncture in the vein in your thigh. Through the small incision above the clavicle, we get access to the carotid artery, and a small puncture is made of this, and a small soft tube is inserted into the artery. This tubing is then connected to a filter system outside the body, and then the blood flow through the carotid artery is reversed. And so the blood flow goes through this filter system, then back into the patient's body through their vein in their leg. By doing this, causing this reversal of flow, when we do interventions on the carotid artery, it has been shown to have the lowest stroke rate of any procedures done for the carotid artery. By doing this procedure, we're actually doing a small incision in the carotid artery, a stent is placed, and then the reversal of blood flow is stopped. The whole thing takes at most an hour. This has been a breakthrough for many patients that are high risk, and again, it's shown to have the lowest stroke rate of all procedures and has a very low cranial nerve injury rate. Patients have very little discomfort and are discharged home the next day. We at vascular specialists are very excited to be one of the first groups to perform this procedure in the Central Florida area. But again, this is not a procedure done on everybody. There are certain criteria that need to be met, but again, we are excited that we can offer this to you.